5 Most Common Symptoms of a Migraine. Though most people have suffered headaches at one point or another in their lives, no one can really relate to how debilitating a migraine is unless you're a fellow sufferer. Research is ever evolving on how traditional and complementary medicine can help migraines. But in order to use the right approaches, you first have to make sure that you do indeed suffer from migraines. Tension headaches are far more common in this age of technology. Virtually everyone over the age of 5 spends their days hunched over a tablet or laptop, or staring down at their phone. Your neck and shoulder muscles tighten, as they sometimes do with a migraine, and the pain creeps up the back of your head. Tension headaches can be incredibly painful, but they are different from migraines and require a different treatment. Migraines are in fact a specific neurological effect. The most painful and high-profile symptom of this effect is an extremely bad, sustained headache. The term is often used to describe a very bad headache, but this is erroneous. The points below will help you determine whether you need to see a medical practitioner to diagnose your headaches. 1. Genetics. Does anyone in your family have the same type of headaches that you endure? Migraines affect far more women than men. So, think about female relatives. You may need to ask around. When you do, don't use the word migraine, as they may as yet be undiagnosed. Describe your headache and other symptoms and see if yours matches theirs. 2. Nausea. A very painful headache with nausea are both symptoms of a migraine. But nausea can be caused by other factors, so try and eliminate those first. Among them are motion sickness and some painkillers. For example, if your go-to painkiller for your headaches has codeine in it, you could well experience nausea and a bloated tummy. 3. Aura. One of the most common types of migraines is the kind that comes with an aura. This precedes the onset of pain and can include dizziness, fainting, visual impairments such as blurred vision, and numbness and tingling in the arms, legs and extremities. If you have any of these symptoms with or without the headache, stop reading and book an appointment with your family physician immediately. Do not try to treat these symptoms with drug-free therapies until you are absolutely sure of the cause. 4. Sound. Migraine sufferers often have a very low tolerance for loud noises, even when the headache is not present. Sometimes, constant loud noises like construction can actually trigger a migraine. If you find a link between sound and your headaches, chances are that it is a migraine and you need to see a medical professional to get it diagnosed. 5. Point of origin. Tension headaches make a painful crawl up the back of your neck and head. Sinus headaches often start with pain and tenderness in the sinus cavities and sometimes present as heavy pain in the forehead. Migraines, however, strike straight at the side of the head, often beginning with one side only. If your headaches are sometimes one-sided, you may well be a silent sufferer. That said, migraines also commonly known to affect both sides. Think about the point of origin of the headache and assess whether you need to see a doctor. Ultimately, living a life that is filled with pain is no kind of life for anybody. If you have persistent headaches along with common migraine signs, it's best to visit your doctor and get checked out. Get a diagnosis and then start exploring what traditional and complementary medicine has to offer to alleviate your pain and other symptoms.